Hello, everybody. Welcome to the Melon Cafe podcast. I'm Veronica Chanel. I am so excited to have my co-host. We're going to be having a discussion with Dr. Angelina. She is a doctor that is based out of Georgia, I believe Atlanta, Georgia,
Correct.
and she has a nickname. From what we're going to find out why she's called Dr. Runway. I would like to know why. But we're going to be discussing 5 reasons why women are experiencing menopause and what we need to know. Those who may be already in the age group, or you may be approaching a particular age group where menopause may be starting. Every woman is different, and why we need to know the importance of hormone pellets. So, Dr. Angelique, this is a specialty. And so I want to welcome you to the Melon Cafe podcast, ma'am.
Thank you for having me. It's awesome to have an outlet to have this discussion.
Yes, yes, ma'am. If you could, can you tell us the areas that you specialize in?
Well, my areas are many. I am actually a surgeon by specialty. I was trained first in general surgery, and that included
Mm-hmm.
trauma and colorectal surgery. And then I progressed to critical care surgery, which is basically taking care of like very sick people. And then later on, I progressed to getting another fellowship in cosmetic surgery. And then I stopped collecting degrees. But as we evolved in our practice, me and my husband were both in the same practice doing weight loss surgery. And then later on, we added skin removal surgery and all the plastic cosmetic surgery. There
Mm.
was a big gap. And that's, while we're doing weight loss, we're trying to help people as we age. And then there was this big gap of what are we going to do about hormones?
Mm-hmm.
And it's like almost a taboo topic in a lot of places. And so that's when we started adding that into our practice as well. And it's hard to find somebody to do it. It's surprising. I mean, I'm not surprised, but it's surprisingly hard to find
Mm-hmm.
a doctor to actually listen to you and address those issues. And so that's
Mm-hmm.
why I started trying to get onto the podcast and social media and everywhere. I usually talk about obesity and other medical issues. Now we're adding hormones because we have to.
Right. Now, do you think the hormones in a woman as she progressing in her aging is that the cause of weight loss, or is just the eating habits?
Of weight gain. There are
I'm
multiple
sorry. Yes,
reasons.
weight gain. Mm-hmm.
Yeah, or not able to lose weight, I guess.
Mm-hmm.
Um, yes, it's definitely part of it. It's not like one hormone or one thing gonna fix everything, but we
Mm-hmm.
have to rationally look at the whole picture. So some people have obesity as a medical disease, right? We have that metabolic disorder. We recognize it as actual medical problem, and it's a
Mm-hmm.
combination of genetics and environmental factors, right? Part of it is genetics. There's that food
Mm-hmm.
noise that can happen in our brain, but part of
Mm-hmm.
it is what we eat. And sometimes we cannot control it, and sometimes we can, and it's a combination, right? Obviously, our sedentary lifestyle plays into that, but there's definitely underlying disorder. Then, as we start aging, if we also have PCOS, and then we start aging, somebody who never had maybe obesity as medical disorder, right around that age of 40, I always joke with my
Mm-hmm.
patient, the diagnosis is after 40. Like once you hit that 40, things just kind of go, right? Things just kind of slide down. We start collecting fat in places we didn't plan to, right?
Right.
Everybody wants to collect fat in their booty and it somehow ends up in their belly,
Right. Mm-hmm.
right? And with like
Mm-hmm.
what's happening, I'm eating the same, I'm exercising the same, have same lifestyle, nothing changed. And after that magic age, 40-ish, things add here,
Right. It
right?
does.
Our
Mm-hmm.
shoulders and our bones start to misbehave where you like, lift your head off the pillow and pull your own shoulder somehow at the same time, right?
Mm-hmm.
Our libido starts to also disappear,
Mm-hmm.
which is not fair because I worked, as a surgeon, first, from like 16 to 31, I was basically in school and working 24/7. Then I
Mm-hmm.
started my own practice, working 24/7. Then I had a couple of kids, trying to raise them because I had my kids late because I was in school and
Mm-hmm.
residency and surgery and everything. And then now I'm like in my 40s and I'm like, this is the time to go have a party, right? And have fun and go out and enjoy your sex life. And then
Mm-hmm.
none of it is happening because I don't feel like it.
Because you're older. You're like, nah.
Well, everybody's like, you're just getting older. That's
Mm-hmm.
normal. That's normal for you things to get dry. That's normal for not to have libido. That's normal for not to want to enjoy your husband
Mm-hmm.
or whatever, or not sense things the same,
Right.
or get angry at people for no particular reason and get ragey
Mm-hmm.
episodes, or get like this ADHD, like almost like attention deficit disorder all of a sudden, where you like were
Mm-hmm.
functioning human, working 24/7, running a big practice and operating on people, and all of a sudden you're like squirrel, and you like forget what you were talking about, right?
That's
That's
true.
not cool. And I'm not
Right.
even talking about like the classic menopausal symptoms, perimenopausal symptoms, the hot
Mm-hmm.
flashes and all the other stuff, right? So why is it
Mm-hmm.
happening? What changed in our body? And that's like a story of every woman, right? I'm
Yeah,
sure we
that's
all have
true.
friends that like sitting there fanning themselves and then, oh girl,
Mm-hmm.
no, I'm asleep by 8 o'clock, right? Like we will have this. But why?
Exactly.
What's
Because
the common denominator?
when we see the word menopause, we think hot flashes. Oh, you're going through the changes, but it's more to it than that. And we're not educated enough, especially women of different cultures, of exactly what's going on. So that's why I was so interested to bring you on the podcast so we could dig deep and educate not just the older women but the younger ones, who, if you live long enough, you're going to be going down the same road, the
Yeah.
same pathway. So is there anything we can do that can avoid, I guess, the disorder that you're referring to before we reach to that point, or it's just like it's going to happen regardless?
It's gonna be a struggle. I feel like we have to find the right doctors. There's not enough
Mm-hmm.
doctors to start with. There's not enough doctors educated on the topic. There's a lot of like negative information about hormones,
Mm-hmm.
right? You'll hear things like, I don't believe in hormones. Hormones are bad for you. You're going to turn into a man. There's so much out there that's not necessarily true.
Mm-hmm.
It might have been true about one study with synthetic hormones. There was a big study 20 years ago where they did it, and they used synthetic hormones that were not bioidentical hormones, and it did not give good results. But when we're talking about bioidentical hormone replacement, there are several options, different ways to do it. Not just pellets, there are ointments and creams and patches, sometimes pills. But those natural things, the more bioidentical stuff, haven't really been studied by big pharma because they have no
Mm-hmm.
reason to do that because they're not going to make money on it, right? Big pharma all wants to invent new things and then they do clinical trials on that. But if they have no plan to make big invention because it's already been invented, we have it, we made it
Mm-hmm.
ourselves, then it's not as interesting for big corporations to study something like that. So now we have to rely on multiple new generation doctors basically screaming from the roofs about it and fighting almost against a whole bunch of other doctors.
Hmm.
Because again, right now I don't know why, because I started talking about it, all my friends, my family members texting me, calling me. I just went to the doctor that told me it's normal. I went to the doctor, I asked to test for this
Mm-hmm.
hormone levels and everything just to get a baseline. They said there's nothing to do about it. I will not treat you for it, so there's no reason for me to test you on it. They're refusing to even do blood work.
Mm.
So it's not just education, which is lacking not just in patients of any color. There's lack of education in medical profession. The reason you
Wow.
don't get education on it because we did not get this education in medical
Mm-hmm.
school.
Mm-hmm.
I know my pathways, I know my anatomy, I know my physiology, I know how hormones work and where they go and what they do. We'll learn that.
Mm-hmm.
But there was never, okay, menopause, perimenopause. Okay, we know the physiology of it. We know ovaries stopped working, you're done, hormones stopped producing, but there was not ever a follow up lesson And this is what we do about it.
Wow. And and this is basically the specialty, the area that you want to take on.
This is the specialty that I am actively, progressively taking on, and continue to self educate and continue to
Mm-hmm.
take more courses and go and see other people who've been doing it for a while and
Mm-hmm.
learning more. And there's books published about it. And, doctors who are kind of stars in the field, right? And
Mm-hmm.
so there are, wonderful doctors out there who a lot of them are female doctors who publishing papers about it.
Mm-hmm.
Recently there was an orthopedic doctor that published paper on musculoskeletal syndrome of menopause. How
Mm.
women get estrogen receptors in every part of our body, including our muscles and bones. And it's like we get to this age and like get a frozen shoulder. She's talking about how it's estrogen lack that can cause that. How estrogen is a huge anti-inflammatory hormone, and a lot of those autoimmune disorders that happen, a lot of that extra inflammation we get in our body, in our joints, in our brain, and everywhere else, could be because our estrogen is not where it used to be.
That is true. Yeah.
And progesterone also plays a big role in our mental health
Mm-hmm.
and obviously our period regulation and stuff. And testosterone, we make testosterone in our ovaries. It's not just for
Mm-hmm.
men. And how that can help with our well-being and our energy level and our sex drive and our sensitivity down there. It's not just one fits all, but we have to be at least having a conversation education about
Mm-hmm.
this.
So you do in your practice, you do the hormone pellet therapy.
We do pellets and creams and pills, yes.
Okay. Now, when a what would cause a woman to want to contact you to come to your firm, your office? What is there any type of difficulties or pain that she may be experiencing that would want her to contact you all?
So I think once people are educated that this could be it, so usually it comes from not doctors, it comes from podcasts like this,
Mm-hmm.
conversations like this, or friends. Hey, girl, I got on the stuff. I'm great. My life is
Mm-hmm.
good. Go get it. And so, or I have patients coming in for surgery, for weight loss, for all other
Mm-hmm.
things. And between conversation, they're like, oh, I haven't done this for so long, or I've been doing sitting there, like I see the symptoms and we then approach them like, oh my God, yes,
I
we need this.
see.
We need to get checked.
Mm-hmm.
A lot of people don't realize the symptoms start way earlier than actual menopause. So,
I
statistically
see.
speaking, our ovaries produce eggs, right? We were born with certain
Mm-hmm.
number of eggs, like let's say
Mm-hmm.
million eggs. And then by the time we get to where we start actually having babies and all of that stuff, we already lost part of those eggs. By the time you get to 30 years old, we're running about one third of the eggs. And by the time we get to 40, we maybe have 10% left.
Mm-hmm.
And every time we make the egg, the ovulation process, right? That's where hormone changes happen in our cycle. By the time
Okay.
we get to menopause, there is no more eggs left. So that's why after 40, some people get it at 45, 48, 50, some people a little older than that. But that's when
Mm-hmm.
eggs gave out. There's no more eggs. So there's no more
Right.
hormones that are made in the ovary, right?
Right. Right.
And the symptoms of, after 30, when we're running on one third of the eggs and then start losing more and more and more, symptoms of actual menopause can stop, has, 4 to 14 years before the actual menopause. So let's say if average woman gets it at 50, that means at mid 30s, some people may start having symptoms, but nobody associates it with the actual menopause, or very few people do, like
Mm-hmm.
the sexual drive and libido. Oh, you just died, you just had a baby, that's why, right? You just
Mm-hmm.
died. Depression, we get more prone to depression and different mental disorders, and usually you get a whole bunch of antidepressants from your doctor and you're done,
Mm-hmm.
right?
Mm-hmm.
Mood swings, those rages, like, right. I don't know if you had that problem, but I did. um the road rage is real.
They can aggravate you. I know. I've been there.
And then all of a sudden you yell at your kids for no reason. I'm like, they just spilled a cup of water, go wipe it up. Like it's not a big deal, but you're like, "Rah."
Mhm.
And I'm like,
Mhm.
that's not me. I'm a surgeon. I usually cool. I'm usually, you can do whatever in front of me. I don't get crazy.
Mhm.
And then little kid
Right.
spills cup of water and I act like, I can't like afford a napkin. That's not
That's
normal, right?
right. Right. That's amazing. That's a shift right there.
So why is
Exactly.
it happening? And so as I was educating myself on of this, I'm sitting there because it could be like 30 different symptoms. You're not gonna have
Mhm.
all of them. They say on average women have maybe 7 different symptoms of perimenopause.
Mhm.
But I'm sitting there doing check mark, check mark, check mark, check mark, check mark.
And that's be like that's it right
I was
there.
like, oh, honey, I need some hormones. Can you prescribe it for me?
What? And so I mean, I like that example that you just gave because a lot of time when we see the mood swings, it's like okay, either it's are you on your period? Is it that time of the month? What's going on? Or we associate it as okay, there's somebody bothering you. We don't go to hormones. That is
Mm-mm.
not. That's nowhere in the conversation ever.
No,
When women talk, when we have girl talk, we're not talking about hormones. We're talking about I'm tired of this or frustrated this, and we don't dig deep to find out exactly why. We don't think about there's a shift in the body. So
right.
I'm glad that you are willing to kind of dive into that. Is do the obesity you mentioned the first part of the conversation, does that contribute to? We know it has some negative effect on the body overall because that have cause her the woman to go through menopause quicker. Could that cause a disorder happen quickly because of obesity, or you just seen it? It doesn't really matter of the woman's overall weight.
No, obesity definitely affects a lot of function in our body. So with
Mhm.
obesity, we have to remember that obviously that could be already an underlying disorder like PCOS that
Mhm.
also messes with our hormones, right?
Mhm.
Then it becomes a vicious cycle with the, let's say if a female with PCOS starts to gain weight because of PCOS, then the fat is not just sitting there. Fat is an active metabolic organ that makes its own hormones and makes PCOS worse. And that's where the vicious cycle starts. PCOS makes the
Mhm.
fat worse. Fat makes PCOS worse. And it's not something you can break on your own. Very few people can overcome that.
Oh wow.
Right? So there's a lot
Mhm.
of hormonal changes with obesity already. Again, fat can store extra hormones. Fat can produce its own hormones.
Mhm.
If you look at the molecular structure of estrogen, progesterone, testosterone, the base of it looks very, very similar to cholesterol molecule as
Mhm.
well. It's a fat-based hormone. So the
Mhm.
more fat you have, the more disbalances in overall hormone levels we're going to have. That's why a lot of women with obesity will suffer with infertility because their hormones are just not doing the right thing, right? Both
I
men and
see.
women,
Mhm.
right? Because
I
it's
see.
spillover of the hormone into the body. Um, when you have insulin resistance, which comes with obesity, it changes how our body carries the hormones throughout your blood. There's this sex hormone binding globulin that runs around your blood, supposed to pick everything up in your blood. When you have insulin resistance, it will act different. You have different amounts of that hormone available. That also is not going to help our overall well being.
Mhm.
So we see as we start losing weight, a lot of those things will change. That's why you see a lot of stories women lose, maybe 10% of her body weight and got pregnant. Why? Because she didn't realize she's going to all of a sudden become fertile because those hormones just balance themselves out quickly.
Ooh.
With menopause and perimenopause, we start gaining weight in midsection, that visceral fat, which is the dangerous kind of fat. That's the fat that leads to strokes, high blood pressures, heart attacks, diabetes and everything.
Mhm.
So with the lack of our female male hormones, testosterone, estrogen, progesterone, we start gaining more weight in the visceral area as well. And
Mhm.
that also doesn't help overall well being. So that's what I said. We've been dealing with obesity all this time, but now we know there's extra hormones at play. So we have to start also talking about the menopause, perimenopause, or for men,
Mm-hmm.
andropause, basically, to see how else we can help. We cannot balance everything out with semaglutide and Ozempic or bariatric surgery. We have to add on that
Mm-hmm.
other that
That
other
other
thing that's
piece.
missing.
Yeah, because if somebody is like she's coming into your office, let's say she's 40, she's coming into your office and you see that she's overweight, it sounds like you're gonna tackle the overweight. You gotta speak to that issue. And then you're gonna have, like, I guess, run some tests is what you would normally do for women. Oh. Is this like blood tests or what type of tests other than that they have to go through?
So blood tests are not the most accurate because we have to remember when
Hmm.
we see blood tests by themselves, I don't want to treat the blood test. I want to treat the person.
Hmm.
So we're gonna get baseline blood tests. We're gonna have a discussion and questionnaire. How you feeling, and maybe go down through some of those symptoms. Do you have this? Do you have this? Do you have this? Ah, ha, ha, you are in menopause. So obviously, we're gonna
Hmm.
still treat the obesity and help with that because that's gonna
Hmm.
help with a lot of issues. We're gonna talk about healthy eating and clean
Right,
eating
right.
and exercising. It's not like one pill. I mean, I wish everything was fixed with one pill or one surgery, but the other things have to be involved. But at some point, we have to say, hey, if you have all these other symptoms, let's run tests on your hormones and see if we can somehow balance them out. But
Right.
again, it's not just blood work. Blood work can look perfect, and you still have all the symptoms.
Really? See,
And unfortunately, a lot of doctors treat the blood work and not the
yes.
patient. That's how you get gaslight.
Yes, you know how many tubes of blood they took? They said, well, this look good, that checked out. You're thinking
Perfect.
everything cool.
You are perfect. I get those perfectly healthy 18-year-old girls with 400 pounds on them in my office all the time. What did your doctor say? They said labs are normal, nothing to do.
Right.
I'm
Mm-hmm.
like, how about physical exam? Did they look at you? Did they see you in person? Did they forget to ask how much you weigh? Because I don't care how tall you are. If you're 400 pounds, we got a problem.
Exactly. Good Lord. Exactly.
And I
They
know a
got
lot of
that.
doctors afraid to talk about it. A lot of doctors afraid to talk about the weight issue as an issue.
Mm-hmm.
But we know
Mm-hmm.
after a certain number, and
Mm-hmm.
it could be different for everyone. It's based on height, it's based on weight and your well-being. We gotta address the issue. We gotta address it because yes, you young and healthy right now, but you obviously overweight or obese,
Mm-hmm.
and that's gonna bite you later on down the road. I don't want to wait until your labs are abnormal. I don't want to wait
Mm-hmm.
until you got a stroke, heart attack, or diabetes, and your toes are falling off, and you got 13 different type of cancer because that's what obesity does.
Right. Right. Mm-hmm.
Why want to wait for that? Why not prevent that from happening? Why would prevent
Exactly.
diabetes?
Exactly. That's why
Why
that's why.
not wait until we have to replace both of your knees?
Right. Mm-hmm. Because that's weight for cranking down on it. Exactly. I
Right.
had to, because I know I'm doing in the middle of healthy lifestyle change too. And so, what the doctors, most doctors give you all the different options. Some be like, let me have it like a transparent moment. I said, I don't want to give myself no shot in my stomach or anything like that. So we using right now phentermine. So I know you already know about phentermine. You're gonna give me your take on that. But
Ah,
it's a control thing, right? I know you're educated on it. And so you can't be on it for so long. But I'm already dropping, right?
right.
So I'm dropping down. So I know as I cut out I love Sprite soda before. Now I cut that out. I'm not as tired as I used to be. I don't feel sluggish. So she
Mm-hmm.
gave me all the little healthy food options. I'm doing more juices and water now. So I feel a change just with soda. I feel a change in even in the way I think now. Certain type of foods I don't even want. I'll be sitting there like, what I want to eat. I don't
Mm-hmm.
know. I don't even. I'm like, I really don't want too much
Well,
to eat.
that's what phentermine does. Phentermine is a stimulant and appetite
Hmm.
suppressor.
Hmm.
It's kind of like legal cocaine.
Oh, don't tell me that. Come on. I'll do drugs.
I'm not saying I never prescribed it. I used to prescribe it. Before GLP-1 medications, we absolutely prescribed it to people for 3 months at the time, but we knew
Yeah.
they're going to come back 3 months later after stopping because they will regain the weight. So it's okay to do for a little bit under well monitored conditions and then transition into something to maintain the weight, because ultimately once you stop the medication,
Mm-hmm.
things gonna want to revert back. Because if the idea that the only reason you couldn't lose weight before was because you ate too much, then all those people out there,
Mm-hmm.
like the remember that show where they were losing weight and stuff, all the people who starved themselves. I know a
Oh,
lot of
yeah.
people who are severely
That's unhealthy.
overweight and
Mm-hmm.
obese, and they basically starve themselves by eating very little calorie intake because they're suppressing their appetite or just doing that.
Mm-hmm.
We know that 99% of those people eventually will regain weight. There were clinical trust studies, reviews where they showed 99% of people could not do it just with diet and exercise alone. So
Mm-hmm.
that means there's another component to it. It's not just decreased calories.
Mm-hmm.
It's not just that one thing. There's something else missing in our body, like that
Mm-hmm.
insulin resistance. Something else is happening where now with this new medication of GLP-1, which is your Mounjaro, Ozempic, we go over all those things. It's fixing something else in your body. It's not an appetite reducer. It's not how it works.
Right.
But it changes how you process your food, how your metabolism works.
So these are the you're not referring to phentermine. It's the
I'm not
other.
referring to. I'm referring to other one. The phentermine specifically reduces your appetite, and
Uh-huh.
yes, it speeds up your metabolism at the moment while you're taking it. But
Yeah.
the moment you're gonna stop
That's what the
taking it,
doctor said. She said you got to make sure I
your
maintain.
metabolism will go room, and your
Yeah.
appetite's gonna go room,
Yeah. Mhm.
and that's gonna be hard to control.
Mhm.
And you
So
cannot take
the
phentermine long
other
term.
so the other medications that you just called out, what else
Yeah.
is it doing? That's what else is it fixing? Is it more permanent for your
As
patient?
long as you take it. It's
Ah,
safe to
okay.
take long term, because if you have chronic disease, if we're saying obesity is a chronic disease, same as diabetes, same as high blood
Mhm.
pressure, same as a whole bunch of other chronic diseases out there, the concept that you're going to only treat it for a few months and then stop
Mhm.
treating it, but expect chronic disease to disappear, does not make
Mhm.
sense. So for some people, I'm not saying 100% of people have to take it for the rest of their life. Some people able to stop it and maintain the results for a while. About half of the people can do that, at least for a year.
Mhm.
But the medicine has to be available to them in case they cannot maintain on their own after a while. It's not a failure of a person,
Oh,
it's
okay.
just progression of a disease.
Yeah, I see. So if they see feel a shift, it's right there for them to
Right.
take. That's the long term option.
That's a long
Okay.
term. And so this medicine does help us too. There are more studies coming out, and that actually feel like it's not just telling your brain to eat less because it makes you feel full. We know it's going to change how you make your insulin, how you process your food, how
Mhm.
fast your stomach processes that food. There are other things that change in your body. And
Mhm.
again, it points out to the fact that starving or decreasing your calories severely and over exercising by itself is not enough. There's something else metabolically wrong with our body. That's why we couldn't lose the weight to start with, or why we gained it to start with.
Right.
It's the
Right.
same concept with
Mhm.
hormone replacement therapy. We used to have hormones, progesterone, estrogen, testosterone. When we don't have them anymore, we're going to take treatment. The recommendation is to use that treatment as early as possible, like right around the menopause, within the first 10 years, to
Mhm.
prevent the bone loss and bone breaking, right? The broken hips in little old ladies.
Mhm.
Cardiovascular disease prevention, because if you wait too long, you already start accumulating those boo-boos, right?
Right.
And
Right.
we're going to take that therapy for as long as we want to maintain our good health.
Mhm.
Same idea, because you cannot expect to stop taking those hormones and then expect to somehow not progress to aging. Like basically, when you stop taking those hormone replacements, is
Mhm.
when you're going to start losing your bone, start losing your muscle, start
I
gaining the
see.
visceral fat back, start
Yeah.
accumulating all the elderly, senile, or whatever you want to call them,
Mhm.
diseases,
Mhm.
including sometimes dementia, like Alzheimer's, being linked to lack of hormones and a whole bunch of other
Right.
things. So when we ask questions, like, for example, some of the courses where I take, and I'm like, when do you think, when would people stop taking the hormone? Because that's what my patient's going to ask. When should I stop taking this medicine? When should I stop taking this medicine? Nobody asks that about high blood pressure medicine or their insulin or diabetes medicine, right? They're
Mm-hmm.
always like, oh, I know I'm going to be for life. But all these other things, people are like, when should I stop taking it? I'm like, and the answer they give is like, when you want to start aging, when you want to get old, like when do you want to start feeling like you're old? Like that's when you're going to
Really?
stop taking it.
Really?
Well, well, if this, like, let's say right now you menopause or perimenopause and you started getting dry vagina, lack of
Mm-hmm.
libido, things hurting you, the mood swings are awful, the hot flashes are awful, right? So you're gonna take hormones to make it better, and you function 100%. Your energy is back, your brain's back online. You can get up in the morning and do things you
Mm-hmm.
plan to do, like whatever it is you were fixing, right? Sex life
Mm-hmm.
is awesome. So at which point you want to give that up? When you want to finish doing that, that's when you stop
Nobody
your
wants to
hormones.
do.
Exactly.
No.
So when you're done doing that, all that, when you get tired of all the good stuff and energy levels and good sleep and lack of
Mm-hmm.
insomnia and good sex life, then go ahead and stop the hormones.
I mean, I, I'm thinking, I'm thinking if the like we talking about the obesity, that if when you start losing weight from what you described to me, when that fat is burned up, it's lifting up off and it's changing the dynamics of our body. Could that cause the woman to start going through menopause at a later age? Since
I
it's
don't know
like
if
it's like
anybody studied that. I don't know if they studied that. If anything, it's probably gonna
mm-hmm,
post. Well, maybe it does. Maybe make it, because it does make people more fertile when you lose
mm-hmm,
weight. Because right now we have this whole thing,
mm-hmm.
but technically speaking, we only have so many eggs that we were born with, and so once we
Okay.
run out, we run out. So I don't
Mm-hmm,
think it can make it go to the later age, because I think a
mm-hmm.
lot of it is genetic, unless there's surgical menopause or some other thing that happened, right?
Okay.
um, like from viruses or surgery when we cut out somebody's
Mm-hmm,
ovaries, then obviously it is what it is. But natural menopause, I think once you finish producing your eggs, you're done.
mm-hmm.
But it make you feel better because a lot of women, like again with infertility issues and other underlying metabolic disorders, not ovulating regularly because
Mm-hmm.
obesity affecting it, PCOS affecting it. They might not be feeling like they get irregular period. There's a lot of women who start losing weight and started getting that period where they used to not do that because they were
Right.
so irregular. And
Or
that's actually part of the
the flows
huh?
become more heavier.
Oh well, that happens with perimenopause is when things start to get
Mm-hmm.
really irregular because our progesterone levels becoming not as regular as they used to be.
Mm-hmm.
So for perimenopause, even if we don't give estrogen a lot of times yet, sometimes we do, but not like regular. Estrogen really starts to get added on after the menopause
Mm-hmm.
officially happened, which is one day after it's been 12 months with no period at all. That's when your official menopause happens. Um, we can still give progesterone to help us regulate our periods. We can still do a lot of things, but basically, yes, all those irregularities, heavy flow, on and off situation, more cramping, more bloating, more constipation. All of those things are symptoms of perimenopause.
Oh
And so the
wow.
treatment should start when you start having all of those problems.
Mm-hmm. Yeah, I like the fact that you're willing to educate the women out here so we would know. Okay, I need to kind of discuss with my doctor of
At least
what's
consider
happening.
it. Yeah.
Yeah, and see, is this a trend? Now, is this consistently going on, or is it like here and there? I like that. Are you thinking about doing like a discussion, like a live discussion on your platform to to educate?
I have been doing that more and more.
Mm-hmm.
Normally, I just do lives on TikTok.
Oh, okay.
That's how I
Mm-hmm.
educate. And then me and my husband, I actually planning to start a podcast ourselves. Generally, we
Mm-hmm.
just put videos on our YouTube channel where we would, do little snippets, little education things.
Mm-hmm.
But mostly, yeah, I do the live
Mm-hmm.
discussions, and then we do our, I call them my meetups. We've done few events where people will come in the area, and we'll do like a whole party, and then we'll sit down and have like kind of an interview style discussions with doctors about different topics.
Yeah,
So we're
that's
having another
good.
one coming up in Tampa in October. And so we will be adding definitely the HRT discussion, because I think now, especially, I have so many people that lost the weight, they look
Mm-hmm.
awesome, who might have done already mommy makeover, daddy makeover on them, but now we want to feel a little better about ourselves. And once we get to that perimenopause, like when you get the
Mm-hmm.
sexy on, so we gotta add that on. Like I
Right.
cannot have this person happy with just surgery and weight loss. Like we need to add the other part, which is
Right.
good sleep, good mood, good sex, good
Right.
everything else.
Right. Because that's the lifestyle. Right. That's the
I
lifestyle
mean,
part.
why
Mm-hmm.
why do anything else otherwise if you
Mm-hmm.
don't feel like doing it? if you if you
Exactly.
don't feel like getting out of bed.
Exactly. I want to also the mental health disorder that can ultimately affect basically everything. When I mean for women, we're referring to the does it cause? Do you see anything significantly different once you have a patient that have a mental health disorder versus one that do not?
So I guess it's the chicken or the egg situation. Obviously, there's some health, mental health disorders that are happening and being undertreated or overtreated or overdiagnosed sometimes.
Mm-hmm.
What I'm trying to say, if the mental health disorder like depression, any kind of mood disorder that start to happen at that later age, what I would
Mm-hmm.
want to see if they're being evaluated for the hormone change, because hormones can increase our depression.
Mm-hmm.
Hormones can, the lack of them, the disbalance in hormones.
Mm-hmm.
We cannot just blame everything on mental health disorder. Like postpartum depression, it could be potentially um, be treated with progesterone. Our
I see.
PMDD, which is, those disorders. So when we say mental, I don't think when we see mental health disorder like bipolar disorders, and a whole bunch of other disorders
Mm-hmm.
that are treated by mental health professionals, affect menopause by itself. But I feel like perimenopause and menopause can make the disorders worse. So if somebody
Right.
is already susceptible to depression,
Mm-hmm.
perimenopause and menopause can make it worse.
Yeah, I wanted to touch base on that because I remember you mentioned depression, and you
Mm-hmm.
mentioned that it alters basically because it's like it's the way our body's set up, and being educated by you and other doctors. It's not just one piece. It's one piece can affect everything else.
Right.
It's all like that. We have so many different systems within our body. It has to have some type of effect, negative effect here or there. And so I'm glad that you mentioned that you have a patient that lost weight. They look good, but we gotta add the other pieces to it. So I like that. So it's like it makes the
We got to put
person
the spark back in. Spark.
uh-huh, right. Thank you for being on the podcast, Dr. Angelina. Can you, if you don't mind, could you like basically recap a little bit of what of the therapy and why women in that particular age group they may be experiencing these symptoms of menopause, and hopefully they can reach out either to you if they're in
Hmm.
the Atlanta area, or they can even call you if they want to. 'Cause some people
Yeah.
are willing to travel to see their
People do
doctor.
travel. People
Yeah.
absolutely do travel. If they find a good doctor that listens to them and does not just say, oh, it's normal part of getting old, because that's what we hear. Oh, that's
Hmm.
just PMS. Well, PMS can be treated with hormones too. Why suffer with
Mm.
that, right? So basically, the way I try to explain to my patients, that one day or whatever, few days when if you are prone to that PMS or PMDD, which is, uh, kind of similar syndrome, where we get those mood swings and that craziness that we get. Some people are
Mm-hmm.
more, again, predisposed to it than others. That's your little snippet of how you're going to feel. And we also get bloating, right? Sometimes with PMS, we get all the other symptoms. That's like a little tiny
Mm-hmm.
window into life of a perimenopause and menopause. It just becomes more continuous
Yeah,
because the
right.
PMS happens when our hormones jump. We have
Mm-hmm.
those changes in our hormones, in our flow of our hormones. And when we have that dip in hormones, we can get those mood swings, we can get those depressive disorders, we can get
Mm-hmm.
those PMS, the classic
Mm-hmm.
picture of a PMS. Well,
Right.
imagine that picture now is constant
Exactly.
because
Right.
now we're
Oh,
getting
yeah.
those hormone
Yeah.
going down and
Mm-hmm.
it's not leveling you out. So you're just going down and you mood swinging, you're angry, but there is not a pickup at the end of the tunnel. So that's who I would say, let's at least get evaluated. And if doctor says you're just getting old or that's just normal or here's some antidepressant, go away, I would say get second opinion. Find somebody who specifically says, I can get you those bioidentical hormones. And that's important piece to mention, not the synthetic stuff,
Mm-hmm.
bioidentical stuff. Whether you get it from regular prescription, like regular insurance covered prescription or compounded pharmacies, because you're going to hear doctors on both sides, no, only this way. Oh, no, only that. I don't care.
Mm-hmm.
Bioidentical hormones.
Yeah, or sometimes the doctors, when they begin to talk to you about the medication, they talk to you about the cost of it. It's like it's cheaper. They'll do the same thing. So we need to stay away from, as you said synthetics. If I heard you
Stay away from
correctly.
synthetic. Yeah.
Okay.
Syntheticals are the ones that kind of gave the bad name to the hormones. We want
Oh.
to get stuff that's as similar, basically identical to what
Mm-hmm.
we produce in our body.
Oh. That's a pro
Okay.
tip. That's a pro
And
tip.
then the things that, especially for this podcast, important to remember females that are of color, so African American females, Asian,
Mm-hmm.
Latinas, tend to sometimes on average get menopause a little earlier than other ethnicities. So potentially a year earlier than average. So if I would say, let's say, average age for Caucasian female, 48 to 52, those approximate numbers for menopause. In African American female, it could be 47 to 51, right? On
Oh.
average, 1 year. I mean, a little earlier. So that
Mm-hmm.
means if you're one of those unlucky ones that gets your perimenopausal symptoms super early, because I said like people say 10 years early, 14 years early, even, sometimes 4 years early. But it's like the symptoms can
Mm-hmm.
start years, decades before your menopause. That means you could be 37 with
Oh.
a full set of symptoms. And
And not even know.
nobody gonna think at 37 years old, oh, must be menopause. Like
No.
nobody
Mm.
thinks that
No.
because
Mm-mm.
we're not educated
Mm-mm.
about it. So that's
Mm-mm.
the recap is if you had previous surgery where your ovaries were removed, or if you just having those symptoms that are not explained and you're not getting anywhere and you're getting the labs are normal, move on with your life kind of thing. Here's
Mm-hmm.
antidepressant,
Mm-hmm.
get somebody to listen to you. So I think the main thing we have to remember, self-advocate, don't take
Mm-hmm.
no for an answer. I
Right.
hear it every day. So that's important point. So some of the symptoms, as I mentioned, it could be like 30 different symptoms. You're not going to get all of them, I hope. But you could get as many as seven.
That'd be too much.
Yeah. So some of the things. So basically, think of every body system. So your brain, funky mood swings, dementia,
Mm-hmm.
forgetfulness. I forgot to where I put my sunglasses. Sunglasses are right here, right? I don't know where my phone is. It's right in front of me. I'm talking to you on it, right? Stupid things. So
Mm-hmm.
all the brain things that all of a sudden start happening. You're the height
Mm-hmm.
of your career, you're functional, all of a sudden you cannot function. Brain things, right? Hair things, like so any body part, hair starts to fall out, whatever.
Mm-hmm.
Skin, this is the age where skin starts to wrinkle,
Yeah.
sag.
Yeah.
Maybe not for you, but for me more for sure.
I don't know.
Some of us are luckier than others. Um, heart, heart palpitations. All of a sudden, heart is racing. You don't know what's happening. You go to the doctor, like your heart is fine, but you're like, well, we
Right.
have estrogen receptors in our heart. in a place where we
Mm.
have regulation of our heart rhythm. If you don't
Mm-hmm.
have enough estrogen, you can get abnormal heart rate,
Mm.
right? So literally, I can name a body part like frozen shoulder. We have receptors for estrogen in bone and muscle. We start losing muscle, I have to work much harder to maintain our muscle at this point. I have to start lifting,
Mm-hmm.
weightlifting, exercising to just maintain what we used to have with just like walking to the bathroom. Um, all the bowel, right? So every organ system, if it starts
Right.
going out of whack, inflammatory conditions, if you think of it, it starts happening around this age. We gotta approach it with, is that my hormones?
Well, that's a good way to see it. That is changing the whole, in my opinion, the whole perspective of viewing our body, because we don't go to, like, if for an example having problems with the knee, we don't go to hormones. We don't go to, oh, I forgot where my place my feet. No one thinks about that. So you onto something. You really are. You're onto something big, because that's like shifting the whole face
It has
of the
to be
medical
shifted,
field. Yeah.
right? And I'm not the one. I mean, again, I there's a lot of wonderful doctors that have been publishing papers on it, orthopedic doctors, gynecology doctors, who are literally leaders in the field.
Hmm.
Um, one of them, Dr. Javier, she has a wonderful book that just came out, The New Menopause. And she actually mentioned it in her podcast, one of her podcasts, where she said when she was a resident and she would go to a clinic and she would get stuck with a patient who nobody knew
Hmm.
what to do with. And would be a female, menopausal, everything hurts, headaches, migraine headaches, this and that. And she said she would just send the patient to like six different other doctors. Oh, heart, palpitations to the heart, depression to the
Hmm.
psychiatrist, brain fog to, neurologist. And so now she realized, and that's, a lot of what she talks about is, well, maybe there's just one thing that's wrong with the person, not five different things.
Hmm. Oh.
And so there's a lot of really great doctors out there. I would suggest for a lot, for older women to find them, read those books, um,
Hmm.
and keep on searching for the right doc.
Right, right. Well, I'm glad if I start feeling some kind of way, start seeing that trend, I'm gonna have to reach out to you. I already got you. I'm gonna have to call you
You can
first
text me anytime.
and say, wait a minute, I'm gonna have to come. We have to run some tests or something, because something ain't right. Well, I'm glad as far as my weight loss, I'm starting to lose, but my goal is to maintain it. Afterwards, because I once you go down, you don't want to build that up. It's easy to gain, but it's so hard to get that off. You want to keep that level. But I want to thank you,
Absolutely.
Dr. Angelina, for coming on the podcast and for you educated me. That's why I said, well, let me just tell you something, because we're on the overweight part and the weight loss. Let me just go ahead and put that in as well. But what else do you see? You do cosmetic surgery as well. So that's, let people know what other services that you offer, at your practice.
So my practice is a large practice. As I said, my husband, he
Mm-hmm.
also is a surgeon. So we started it together. So it's kind of like one-stop shop. So
Mm.
general
That's smart.
surgery. General surgery is your hernias, so lumps and bumps, your hemorrhoids, your fistulas, pyelonephrosis, things that are crazy, but when people need it, they do fly from all over the country to get it fixed with special laser procedures.
Mm-hmm.
Weight loss surgery, which is your bariatric surgery, gastric
Mm-hmm.
bypass, gastric sleeve, and a whole bunch of other minimally invasive procedures for weight loss. It's not just two, there's like 10 different
Mm-hmm.
types. And then, of course, that's why I got into cosmetic plastic surgery, because after we started doing bariatric surgery, then we got all the people coming back saying, now what? We got loose skin. So that's
Mm-hmm.
how the plastic cosmetic surgery component was
Mm-hmm.
born. And we are, I think, 7 or 8 surgeons now in 2 different cities. Well, three. We in Atlanta, Georgia, Tampa, Florida, and Hudson, Florida. And we have 2 plastic surgeons, 2 cosmetic surgeons, 3 bariatric surgeons, and several mid-level providers as well. And now we're adding hormones as well. So we pretty much can hopefully take care of the most things that people
That's big.
complain about. And then we specifically specialize in transparency and pricing. So we build in a way that if person does not have insurance or underinsured or have very high deductibles, we
Mm-hmm.
can usually do a surgery for cost for self-pay at
Mm-hmm.
very reasonable pricing. For example, right
Oh
now,
wow.
gastric sleeve surgery, I'm sure gastric sleeve is very common weight loss surgery when we go with the cameras inside the belly, make the stomach smaller. National average for the cost of that surgery out of pocket is like 25 to $45,000.
Mm-hmm.
In my practice right now, it's $79.99, so $8,000,
What? You
all
gonna have a
inclusive.
lot of people running to you.
People come, right, and they come from all over the country because we don't recommend for people go to Mexico or out of country because it's dangerous. So we basically, the model tries price transparency. We try to bring prices to the best price that we feel like people could afford. So like gallbladder surgery is even less than that.
Mm-hmm.
Gastric bypass is maybe 14, but still national average is closer to 65. So we're like, we're trying to bring prices to the point where it at least sounds more reasonable
Right.
to
Right.
considering what healthcare and all the supplies and everything else cost in the United States.
Right.
And with that, we're trying to make it like one place where people can come and take care of their boo-boos.
Oh, they gotta reach. You gotta reach out to Dr. Angelina firm, guys, because this is good. Because the price difference that you just called out for
Mm-hmm.
that the weight loss surgery with the sleeve, my goodness. Because I heard this a lot.
It's a
When I
lot.
first heard it, it was actually more than that. What someone told me that they had to pay. I was like, nah, that's
Oh yeah,
not.
and if you look what insurances pay, insurances would pay to the hospitals. Like people like I had a $64,000 bill like 5 years
Mm-hmm.
ago, and of course since Corona, all the prices went up.
Mm-hmm.
Um, but we still going strong. So this is a special. Like they're writing some specials right now, but still the prices
Mm-hmm.
are. Some people come in, they're like, my insurance doesn't pay for bariatric surgery at all, or they do pay, but they make me wait 6 months, and then my deductible is $10,000. I'm like, well, we'll do it for less than deductible.
Oh wow, my goodness. Well,
So
you
we're
gotta,
trying.
you
We're trying.
yeah, that is good. That is good. You willing to be there and help the people. I mean, because the way it is now, you already know. It's like I can't do this, can't do that. At least you're meeting us halfway. Everyone to halfway to at least help. You don't find too many doctors or practices that's willing to do
I
that.
know.
You really don't. You really
I know.
don't. You really don't. So thank you, Dr. Angelina, for coming on the podcast. Oh my God, I gotta have you back. We gotta talk some more.
Oh, we
Another
can do it.
topic or something. Because you educated me on hormones. Now that's gonna stick in my head.